Thank you, everyone, for coming to our webinar series, once again on data and measurement in youth mental health. The webinar is recorded and you can have access to the recording later. Before I introduce myself or say anything further, I just want to let you all know that we do have translation available if you go to the bottom of the screen and hit French captions. Unfortunately, we don't have live voice translation, but you can, as I mentioned, go to the bottom of your screen, hit the caption button, and then click French translations. If you have any issues, you can just let me know in the chat. And you can ask any questions in French or English, and we can translate those as well for folks. I'm Alyssa Frampton, and I'm the coordinator of the CIHR Catalyst Grant in Youth Mental Health. And we're a Pan-Canadian network grant, a knowledge translation grant, aiming to provide opportunities for youth mental health community across Canada, and through this particular series also globally, really to engage and to network, to share developments, and to build collaborations around data and measurement specifically in the sector. And through this webinar series in particular, we're really looking to better understand the current and future landscape around data and measurement in youth mental health. What's happening, what are the gaps, how are innovations filling them, and also how can we move forward together. This could really range from issues such as how to integrate data collection, evaluation, services. Sorry, I saw Jason join again. I just wanted to check.
I'm having some technical problems here. My Zoom keeps crashing.
Oh, no worries. I just wanted to check in. I think I was just saying a little bit about the series, but yeah, so it can just, the series can range from issues such as how to integrate data collection and evaluation services settings, novel or innovative data platforms, opportunities, learning health system approaches, and more. And so far, the series has touched on why data and measurement matters, the basics of what it means to have a learning health system, things we might want to consider about standardization. And you can find those past webinars for a series on our YouTube page, and I'll add that link in the chat in a moment. If you were here last time, you know I didn't add the link in the chat, so I will do it this time. Last week, we heard from Dr. Untel on responsible measurement in youth mental health. His talk's actually not quite up on the YouTube yet, but you can check back after the long weekend and you'll be able to find it there. So I'm going to put this right into the chat now before I forget. And yeah, you can also learn more about the grant at our website. It's www.catalystymh.ca. You can also visit our last webinars there, and I'll add that to the chat in a little while. And the last thing that I'll say before I introduce our speaker are that we welcome you to add questions throughout the series. Like if you want to add questions to the Q&A function, or if you want to add questions to the chat, please go ahead. Also, if you want to raise your hand at the end and speak and have your mic turned on so you can ask your question, you can also do that. And yeah, I will say that again at the end, and I'm going to go ahead and introduce our speakers and turn it over to them. So Dr. Gina Dimitropoulos is an associate professor at the Faculty of Social Work, cross-appointed with the Departments of Psychiatry and Pediatrics at the University of Calgary. She holds a research ethics chair in systems levels interventions for equitable and accessible youth mental health services. She leads a national multi-site projects focused on integrated youth services, transitions in care, and peer support related to youth mental health, chronic health, and child maltreatment. She brings expertise in integrated knowledge translation, community-based participatory action research, and mixed methods designs. And Jason Gondziola is a senior project manager with the Alberta Health Services and is responsible for the day-to-day oversight and direction of the eMental Health for Youth and Young Adults project. Jason has managed projects across a variety of sectors, including mental health, First Nations language reclamation, digital storytelling, and software development. And so we're so excited to have you both here and to learn more about measurement-based care and digital eMental health. I will hand it over to you, and I'll come back at the end when you're over to help facilitate the Q&A session.
Thank you, Alyssa, and the Catalyst team for inviting Jason and I to present today. We're just really feel very privileged to have this opportunity, and I always enjoy presenting with my good friend and colleague Jason. You'll see us go back and forth together. We love this topic, and so we're excited to share our work and to really get your thoughts and questions and hear about the work that you're doing in your own communities and settings. So I'd like to just take a moment to acknowledge that I am calling from the University of Calgary, which is located in southern Alberta, and I'd like to pay tribute to the traditional territories of the people of Treaty 7. Which include the Black Confederacy, which is comprised of the Siksika, the Piikani, and the Kainai First Nations, the Tsuut'ina First Nation, and the Stoney Nakoda, including the Chiniki, Bearspaw, Goodstoney First Nations. And the city of Calgary is also home to the Métis Nation of Alberta, District 5 and 6. So I want to take a moment to also just acknowledge that we are part of a very large team. We're really speaking on behalf of a large group of colleagues in Alberta and beyond. The project that we're going to be talking about has received funding from a number of different sources as well, including the Alberta Children's Hospital Foundation, Alberta Innovates, and also Alberta Health. So we couldn't be doing this work if it wasn't for our funders. And then we have really strong collaborations between the Alberta Health Services and the University of Calgary. In fact, our team is one, but we are spread out between AHS and U of C. And so you hear us back and forth talk about the different members of our team. And then we've got lots of support from our Australian colleagues, including the folks who have developed the InnoWell platform, and then the research colleagues who are affiliated with the University of Sydney. So our research team, and I just really I won't read everything, but I just want to acknowledge that our leadership team is our nominal PI is Dr. David Johnson, and then myself, and then Jason. We have other members of the leadership team, but I wanted to acknowledge these three people who are really helping, I think, do a lot of the work that is being led by the folks who are really on the ground, who are the implementation team. And Jason can speak more to, we couldn't be doing this work if it wasn't for those who are on the ground, really working with the youth, the practitioners, decision makers, to really help implement the work that we're going to be talking about today. And we've got lots of other folks, including youth with lived experiences, youth research partners who are really helping move the needle and helping us to think about how to implement digital eMental health in people's everyday life. So the agenda for today is we're going to give an overview of the eMental health project. The methodology is very much focused on the pre-implementation work that we did to identify the potential facilitators and barriers in folks implementing eMental health. So it's kind of thinking about what people identify as getting in the way, really, of folks being able to adopt the InnoWell platform. And then we're going to share with you some findings that have emerged from some data analysis that we've done on our qualitative research, identifying kind of the organizational factors that might get in the way or help facilitate the implementation of InnoWell. And then the findings on another paper that's been submitted for review that focuses on how it's really important to address social determinants of health. Or if we're going to do any work that, that entails introducing eMental health, measurement-based care, if we're not addressing the social determinants, then we're never going to be successful in being able to really help people adopt digital mental health options. And then we'll talk about our limitations, our strengths, and potential next steps. So an overview of the eMental health project. I mean, I just want to really quickly, and I know I'm probably really we're speaking to people who already know a lot about this, but We know there's been a rise in mental health issues, all mental health problems and substance abuse, misuse in youth and young adults, and that there's a real gap between the needs of those with mental health issues and then the services that are being delivered. We know that there's long wait times, there's a shortage of mental health professionals, shortage of people who are trained to provide effective mental health services. And for those who live in remote and rural communities, it's sometimes incredibly difficult to even find someone who can provide mental health services, let alone access digital mental health. And yet digital mental health interventions are being touted as a potential solution to the mental health crisis. And we know that there's potential here that, digital mental health may be able to provide a more cost-effective way of responding to mental health, the mental health crisis. Perhaps it's a way of, really serving people who are on long wait lists. It could be a way of ensuring that people can get quick access to mental health services. It may help facilitate a more effective communication between people with lived experience and mental health providers. And it might be a way of better embedding measurement-based care so that we can help track, how people are changes to their mental health issues, better way of tracking, treatment changes. And really, it's a way of empowering young people to be able to also use digital measurement-based care to communicate with the people in their lives who are supporting them along their mental health journey. So I'm going to turn it over to Jason to talk a little bit about the Equitable platform.
Thanks very much. Also, due to technical issues, I'm not able to see your deck, but I believe everyone else can. It's something on my computer, so I'm going to do my best to follow along. So we're going to just chat a bit about the Equitable platform. This is the tool that we're currently deploying across numerous contexts here in Alberta. It's a eMental health and digital measurement-based care tool that was developed in Australia. It's basically there to assist in providing mental health care by collecting a variety of patient self-reported measures and psychometric measures. And it's a tool that clinicians can use to empower youth in their own care. So moving forward, we can see that the platform has a number of different domains. As it is currently configured, we've got 20 different domains. And when we say domain, what we're really speaking about is like a specific area of mental health. So if you look here, you can see that there's an anxiety card or grief and loss, resilience. These are all attached underneath to a clinically validated measure. So for instance, anxiety uses the OASIS measure, and there are different measures within the platform that can exist under that card. So the 20 that we're using right now, and I'm saying that to kind of tease some things that we're going to be bringing up later, but the 20 that we're using right now are subject to revision, and you can redesign the platform to use different measures underneath these. So each of these health cards here has tracking data. It also has access to mental health resources, apps, tools, and crisis support. So when a user clicks on one of these cards, it pops up their graph of how their progress is, as well as other links to clinical services, non-clinical services like apps and e-tools. Moving forward, we are implemented in 11 Alberta communities, and we're deployed in varied service settings. We've got AHS, addictions and mental health, largely community clinics with a handful of specialty clinics as well. Primary care networks. So for those who aren't coming from Alberta, these are physician-led care networks. Schools, principally through school counselors, psychologists within schools, or family support liaison workers. And then a handful of community-based supports. So in Alberta, we have FCSS, which is Family Community Support Services, I believe what it stands for. They're basically community, like they're often attached to a municipality, and they are there to provide social and support services for individuals in that community. I'll pass it back to Gina.
Thank you. I was on mute. Sorry. I just was going to say, you could see how Jason and I, we can work with whatever crisis technology presents to us. So I'm going to just share with you again the findings of two of the papers that we currently have under submission. So the guiding question for our presentation is, what are the pre-implementation perspectives of mental health care providers on the feasibility of the eMental Health platform to meet the needs and priorities of their clients and communities? I just want to share that Jason and the team and I have a lot of youth-related data. So we're not presenting on the perspectives of youth today, but we are in the process of pulling and analyzing that data, and very happy to come back and present on the youth. So I just want to share with you that we're just going to be focusing on what providers have shared with us across these different communities, these 11 communities that Jason was speaking about. So I'm going to talk very briefly about the methodology, just to let you know how we recruited people, what our sample consisted of, and then I'm going to go right into the results, because that's really, I think, the most exciting part, and then the discussion. So we recruited through our site leads and clinical supervisors of each of the communities, and I want to say we're recruiting people from schools and Alberta Health Services, the healthcare system, and also primary care and community-based organizations. So we have a very diverse group of people who we were hearing from about the potential of, their perceptions of what it might be like to embed the InnoWell platform or digital mental health in their services. And we developed an interview guide that was based on a framework. We really wanted to be able to think about the theoretical framework provide us with guidance around thinking through the various ways in which people may have different difficulties adopting a digital tool like this or a new intervention. We conducted 23 virtual focus groups that occurred over 90 minutes. And I just want to share that this was all done, during the pandemic, or the heightened time of the pandemic, and which was to us, really, it's critical to point that out, because we still had such great engagement from our partners throughout the province, despite the fact that they were, really working under very difficult and challenging times. So our demographics are as follows, just very briefly, because people will send you a copy of the PowerPoint, so you have this, but we primarily had women, females who participated, people from various professional roles and even age ranges, and the length of time that people participated in their professional roles also varied with quite consistently, and also the different level of education of the people participating.
I'm trying to look at this book for.
I'm wondering if it would be okay, people, we could maybe mute themselves, because I'm having a lot of background noises, unless it's coming from me. Okay, so the first paper that is under review right now that I'm going to be sharing, so this is a little bit hot off the press, but it is also in draft. We always say that, there's going to be changes to this, because once it gets reviewed and we respond to comments and about the limitations, that what you might end up reading when this does get published might be a little bit slightly different than what we're presenting here. But so the first paper, our findings that I'm going to really talk about is the organizational factors that sometimes can really influence the adoption of digital eMental health. And we have 3 themes. And the first one is how to navigate the implementation of eMental health in the current context. So there are a lot of concerns and issues related to training, education, and information to increase the knowledge and capacity of mental health providers, and really embracing eMental health. The second theme has to do with, really having all hands on deck in the kitchen, so to speak, it as a metaphor, and people learning how to really work together in a coordinated and effective way to implement the digital and mental health, the eMental health platform within the mental health system. And then the third theme is that we heard that mental health providers are really change weary, that there's so much change happening, and again, happening during the pandemic, that sometimes people feel really overwhelmed by what's being asked of them. It's just another thing that we have to do in our everyday practice that can make it really difficult, but at the same time, they're nimble and they're really good at responding to crises and challenges, and they're a very resilient group as well. So I'm going to talk about the first theme, which is challenges navigating the new mental health world. So the first barrier that we heard is that there's a lot of obstacles to integrating digital mental health into clinical practice. And people spoke about sometimes there needs to be a lot of efforts put in place to really know how to respond to the changes that are being asked of them. So sometimes it's really hard to customize the eMental health platform, and people are really worried about, how do I take this standardized platform and embed it when I work with very diverse young people? And how can I make sure that this is going to still be responsive to the needs of the young people that I'm working with, when it can seem so rigid and inflexible to use? And then people also raised some really concerns about data security and privacy and confidentiality. So just to read a quote from one of our providers is, "We're getting pressure from our own system to have short-term therapy. It's going to make it harder for clinicians to want to enroll youth in a platform where we might only have X number of sessions, and then we can't keep them open. So we have to close them. And when we close them, we know that means you have to end it for the youth, because you're no longer connected." So the concern that was being raised here is that if you're only seeing people for a short number of sessions, to ask them to complete 20 measures, as Jason shared, there's a really, very very, very methodical way of, really ensuring that we're asking people to complete measures that encompass various mental health issues. But when we're asking people to do that, when we're only seeing them for a very short period of time, can feel very cumbersome and alienating. And there's a lot of worry that time could be, maybe not be used widely. We also heard that the other barrier is that there's concern about the low digital literacy. What if people really don't know how to navigate, and really are going to have difficulties with knowing how to use this platform that can seem really just very, again, cumbersome, and there's lots to navigate, and who will be there to help the youth to be able to use this platform? And then we heard as the next theme, sorry, I'm needing to, oh, sorry. Can you hear me okay?
Yep.
Sorry, it's just freezing on me, so
Oh, no worries. We can see your slides and I can hear you. Jason, though, had to drop off, and he's going to try to reconnect because he's having some technical difficulties.
Okay.
Zoom
All right,
doesn't want us to be working before the long weekend.
Yeah, exactly, because it's just frozen for me right now, everybody. So I'll just really quickly say that for facilitators, we heard that the eMental health platform it could potentially help improve continuity of care across just different systems. So for instance, if a young person agrees to use the eMental health platform and can invite people to be on the platform who are their supportive adults, whether they be professionals or part of their network of supportive people, then it would allow them, regardless, to be able to not have to tell and retell their story, because the folks who would be on the platform that they've agreed to identify and allow them to have access, they might be from the healthcare system, they might be their family doctor from their primary care service. It just allows the continuity of care to be easily implemented, because the platform would allow better communication, coordination and communication. So I'm just going to switch over, and then we heard that for the third theme is that people, again, are very change weary but nimble, and so there were some barriers and facilitators that were identified. One is that people were really skeptical about the increased time commitment that would be required for them to learn how to use the eMental Health platform, and that there's so much change that's already underway within mental health systems that is it going to be really time consuming for them to do the work that's required for them to know how to learn how to use eMental Health. And unless they're decision makers, people who are in positions of power, if they don't, allot protected time for them to learn how to use the platform, then they're really skeptical that they're not going to be able to do this. They would rather commit their time to be able to be seeing clients than to be, seeing.
All right, sorry. Thanks for weathering all of these technical difficulties. My laptop, my work laptop crashes when anyone shares a screen on Zoom. It's very weird. So going through the discussion points, I'm not sure where we had left off, but one of the things is we are seeing this kind of shift towards using technology to meet the needs of clients, especially following the pandemic. And that actually bears out. I had done a little bit of research on that during my master's, looking at that transition point. Definitely, it's a huge challenge for providers to perform these services with like measurement-based care while learning a new platform. What we see from the literature is that measurement-based care is really a promising way to inform clinical decision making. It supports treatment planning, provides targeted care, and allows you to track progress and improve efficiency. One of the things too around patient privacy, certainly this is echoed in other work. It's really underscores this very 21st century need to establish standards and best practices on the use of technology in mental health care. I think also, if I think about that outside of, legislation or rules, I think part of that also is a function of the stigma that is around mental health, and why that data seems even more important to, safeguard with strong privacy. So there's efforts underway to document best practices. We're looking at Canadian Federation of Mental Health Nurses in 2024 and the Canadian Counseling and Psychotherapy Association. And then our findings really suggest that a digital mental health platform would be useful as a discharge tool to support youth with continued digital care and resources. And there is some literature around that. I can also add that in our own looking around of how people have used digital mental health, we've got a use case out of Australia where they do an 8-week tail off period. So you're discharged from service, but for 8 weeks you're monitored via your platform scores. So that's also there. Gina, I can hand it back to you. I'm not able to share the deck, but we're just on slide 20.
Okay, I'm just pulling up the deck. I had to, for some reason, my computer crashed and I had to use another one to get back
Well,
in.
I can maybe start speaking a bit about the recommendations that came out of that one.
That's great.
I'll weather
Thank
this
you.
storm. Yeah. So, one of the big organizational recommendations is a need for training and education to increase knowledge and use digital mental health. And I think that rings true for the measurement-based care side of it as well. Something in our own implementation that really became clear was that one of the principal barriers to implementing a digital measurement-based care system is measurement-based care itself. It's not really a part of the standard of practice for a lot of mental health sites that at least from what we've seen. So, to do that, we need training and education. So looking at in-person and online asynchronous formats, equipping leadership with change management strategies, providing training on those technical skills and competencies, and also looking at digital navigators as a kind of continued support. The next recommendation is looking at coordinated digital and mental health systems. So, the benefits of connecting youth to resources, information services, safety plan, and designated relevant professionals in the care team for situations where there's escalated suicide risk. That was a real, for us on the implementation side, a real challenge was having a system that offered, practically a real-time suicide risk monitoring really shined a light on the fact that our health system was not designed to deal with that kind of information. So making sure that our sites are well equipped with a response plan. And I think, from a longevity and sustainment perspective, probably looking at immediate referral to a centralized crisis service, via the platform. And then, increasing that coordination between digital operating systems to avoid duplication of work. What we call that in the software world is interoperability. And that is a huge, huge barrier. The fact that you actually are running 2 or even 3 systems in parallel leads to a number of problems. People might just choose one of them to work with. If they choose 2, you've got some of those risks around double data entry. So lastly, I'll just quickly touch on leveraging the behavioral change towards new paradigms of mental health using measurement-based care. So making sure that you're involving staff in those change discussions, restructuring your workloads to allow time. And I think that's a really big one. We see that with leadership, that when you provide time to your staff to pursue this, you're going to see a better return on your investment. If you just drop it in and offer no extra time, I don't know where those frontline staff are going to find the time. And then highlighting the benefits of measurement-based care and the highlighting the alignment of it with the provider approaches. It's client-centered, solution-focused. So I'll turn it back to Gina now.
Thanks, everyone. I have to say the irony of Jason and I doing a presentation on digital eMental health, and here we are, our computers are crashing, our internet isn't working, but anyway, it's kind of funny. All right, I'm going to quickly go through the social determinants of health findings regarding eMental health, because I really want us to make sure we have time for discussion. So this is, again, a paper that's currently under review, and want to acknowledge there's lots of folks who are involved in this work as well. And we found 3 key themes that the providers felt it was critical to social influences on youth accessing digital mental health. The second theme has to do with the social economic circumstances that may influence whether young people can even access eMental health, and then the impact of community and systemic factors on youth's access to eMental health. So for our first theme, we heard that young people experience significant stigmatization around mental health issues and marginalization. That sometimes makes it difficult then for them to access eMental health. And then in small communities, if eMental health is embedded within a service setting, whether it's in the school or in higher level care, specialized programs, if they are experiencing stigma and have concerns about being outed by, using eMental health, they're just not going to do it. It doesn't matter, how accessible the eMental health platform is to them. That stigma will still, in their communities, will get in the way of them being able to use it. So since eMental health is also a tool that could be used in the context of people's own home, that many providers have concerns that there may be many young people who might not even think about using the eMental health platform if they felt that it would be putting them at risk of, again, other members of their family or communities learning that they, were accessing a platform to obtain mental health services. And then we heard about socioeconomic circumstances that are critical for us to address if we're going to be ensuring that eMental health is a tool or platform that can be used equitably across different contexts. We heard that for some young people that, it's just, we got to prioritize meeting people's basic needs, their fundamental right to like having housing, and we think they're also identified having access to Wi-Fi as being a critical and fundamental right, that we've got to make sure that all that is in place if we're going to if we're going to ensure that eMental Health platform is accessible to everybody. We also heard that there are significant contextual and systemic barriers that need to be addressed when we're thinking about the implementation of eMental Health, that in rural and remote communities, and apparently in cities as well, because I'm in Calgary and having Wi-Fi issues, but we have to recognize that there are significant limitations in people being able to even access Wi-Fi, and that communities are also very resilient and very good at problem solving, how to ensure that their youth have access. And youth are very good at coming up with solutions, like maybe being able to put like, the eMental Health platform, finding a way of maybe embedding it within the local library where young people can access. So I want to like highlight that, yes, we heard there's lots of, challenges in remote and rural communities, but communities are also really good at coming up with their own solutions that are going to be effective. But we need to think of like what can occur at a provincial and a national level to ensure that all people have access to Wi-Fi. So some communities have limited Wi-Fi cellular infrastructure. We heard that there's limited support for clients where language is a barrier to completing assessments and understanding access to either to studies that are being done using eMental Health. But I wanted to emphasize that for a lot of, if this is going to be a national, we're going to be thinking about eMental Health being offered nationally, that it has to be offered in multiple languages, and of course in French. And that for people who have had really negative experiences with, mental health systems, there's lots of distrust or, from experiences of colonization, and just really feeling like, they're not going to be seen and for who they are and for their experiences of marginalization. They're not going to feel safe going onto an eMental Health platform because they're going to be worried about how that information is going to be used to potentially cause further harm. So our discussion point is we need to really think about, the eMental Health platform or any eMental Health platforms. We need to address how to, ensure that mental health services and eMental Health is accessible and equitable to all individuals. We need to ensure that we are thinking about how to make the measures that are embedded within eMental Health platforms also address issues around digital literacy and just literacy in general, and then really addressing all the barriers that may confront young people. And I just want to really quickly talk about like some of the recommendations that came out of this work and that we think are critical, that we need to address stigma that sometimes can be more pronounced in rural, and this is, again, this came out of what the mental health providers were recommending, that because I really want to emphasize that stigma is pervasive. It's not just in rural and remote communities, but there may be different things that we need to address in rural and remote communities. There was a real call for increased attention to underserved populations who may be at high risk of experiencing intimate partner violence or violence that it gets perpetrated against LGBTQ2 spirited communities, where being on an eMental Health platform in their everyday lives may put them at increased risk if somebody sees them accessing websites or services. So we need to think about how are we going to really ensure that we're putting some safety plans in place to keep people safe. We need to provide, any compensation for transportation that people have to take to be able to get to services where they can use eMental Health platform. We talked about the importance of infrastructures. We need to identify safe locations in communities where people can access eMental health services if they can't do that within their own home. And we need to think about linguistic and cultural inclusivity when developing these eMental health options as well. And we need to train providers to think about how we talk about eMental health may not be the same for everyone. We need to think about, underserved or marginalized populations where they may have experienced a lot of violence or mistrust, or just need to really think about like addressing issues around confidentiality and safety when they're using platforms. So the strengths and limitations of our work as researchers is that we really are trying to, the strength is that we're capturing the experiences of providers from across different settings and communities. We involve people from in different positions, from those who were in leadership positions, from those who were on the front line as providers from different perspectives. And we also included people who were staff. We felt their voice was as critical as people who were decision makers. And the findings, we may have not captured nuances that we just didn't think about. And like this, even this issue around social determinants, although we really probed about that, it wasn't as central in our initial interviews, that we now recognize has to be at the forefront. So there may have been experiences that we didn't probe enough and capture enough, from Indigenous partners and individuals who identify as being part of gender diverse communities. And we also recognize this is the Alberta context. Every context is different. So we want to really be careful about not generalizing our findings as well. So our next steps, I'm going to turn it over to Jason now.
Yeah, thank you very much. I think a real key part of our own strategy in doing the implementation is being very iterative. And I'll borrow a phrase. I did some work around social innovation, and there's a concept there of fail fast, fail forward. So for us, the faster we can figure out something doesn't work, the faster we can iterate towards something that does. And kind of as I was setting up earlier, one of the areas that we're actually really looking at is, can we streamline the number of measures that are being deployed and bundle other measures for other points down the care stream? So I'll give you an example. Can we do a sort of broad, maybe 4 or 5 measure intake assessment? And if at some point, either through that or through a disclosure, you discover that a client is dealing with addictions issues, then there could be a suite of other measures that are then applied, and those can be used. So I think that that's something we're really looking at, is rather than the default setting with the platform was, 20 very broad measures. Let's capture a broad and deep view of the client, but at the cost of 45 minutes per completion. So I think for us that's a real area that we're interested in exploring. Through that, we're looking to sort of evolve different types or setups for, say, like, what does a school prioritize? What does a school counselor need to know? Do they need the really clinical depth, or do they need a more occupational function or social and occupational functioning type measure? So there's a bit of that. The online survey, I'm guessing that's a research point. We're looking at collecting more data as well from that. And then really, comparing implementation data to hear about challenges in facilitators. And we're very data driven in what we do. As an individual moves through getting onboarded onto the platform, we have a number of time-stamped statuses or actions that we can use. And then we can also look at, what does the client completion rates on the platform look like? And we'll soon be able to start to look at that in terms of, what does clinician engagement look like? And from that, maybe start to derive some markers of success at a site. So I think that that's sort of some exciting work that we're looking to do over the next 8 to 10 months.
And I just want to thank you, Jason. I just wanted to add that from the research perspective too, as Jason mentioned, we're now collecting perspectives, experiences from different partners, including youth, the mental health providers from all 3 service models that we described, primary care, schools, and higher level care, and all of the communities across Alberta, to really hear about what it's like to actually implement. So again, the data that we've been presented today is what people thought might potentially be the barriers of facilitators, and now we're using a survey and a qualitative approach to really gather, but what has it been like? What are the things that you found to be most helpful, and what are the things that are continuing to be or are a challenge? And we try to synthesize our results and rapidly give back to the implementation team, to Jason, and to communities to ensure that we're really addressing as quickly as we can. So Jason and the implementation leads are so good at like hearing, even our preliminary results and then rapidly thinking about how we're going to address it. So we're not waiting until the end of the study to respond to the challenges. We're right away being responsive and wanting to really support people to like be able so that we hear them and really try to implement their recommendations for how we can improve things as well. And so we want to thank you and for this time and this opportunity, and really are grateful for this, for your kindness and bearing with us as we've been struggling with our technological issues.
Thank you both so much, and don't worry about the technical issues. It's all okay, such is life. We actually, folks, please write any questions you have into the chat, or you can use the Q&A function. You can also hit the option to put your hand up if you'd like to ask a question. I do have 2 questions which are kind of the same that had come in, so folks can when they register ask a question as well. So there were 2 which are again kind of the same, so I'm going to share both of them and I can repeat the second after. But the first one was, what ways did COVID-19 shift how digital health was implemented in the sector, and do you think that these shifts were positive and helpful? And then the second question was, what has changed over the last 4 years since COVID-19 when it comes to eMental health and using eMental health platforms? So I'm wondering if you wanted to take those on together.
You go ahead, Jason, and then I'll go.
Sure. Okay. Thank you. Yeah. I mean, to the first part of what changed, I think, and I heard it wasn't even through the health sector. It was basically someone offering an industry analysis for like on a tech, it was like, tech stocks. But what they kind of outlined was COVID effectively pushed forward video conferencing and remote technologies by about a decade. We actually compressed about what would have been a decade of natural growth into a very short period. And I think we also saw that with mental health. I kind of touched on this briefly, but I had done a bit of research in my master's working with a few providers out here in west of Edmonton, and really the push towards digital offering of services was necessitated by the fact that it was the only way to do it. So I think we saw quite a lot of that. I think in terms of what's changed over the last 4 years is that sort of raised the floor in terms of an overall comfort. But we really also see a really continued sense of burnout from the front line. Like there's a real change fatigue. There's some real challenges. And I think a lot of that came from some of the, both nuanced and very blunt realities of the pandemic in terms of being overrun with cases, having, at least in Alberta, sometimes an antagonistic relationship with your own government, or some of the, protests that took place outside hospitals here. So like, I think we're also seeing that a bit too.
I was just really quickly going to add that I think, because I agree with what Jason has just said. I just wondered if maybe one of the changes that I've seen around digital mental health is that the young people still want choice. They want to be able to choose whether they see their provider in person or they see them virtually. And so I don't know that we're ever going to, or should we, replace one for the other, that it's the right to choose and to also not have to choose one consistently. Like that we should be providing options and maybe creating safe, I don't know, I'm just going to use this loosely, a space for providers to also be able to say, I've got a preference for X over Y, and then be able to like help me learn more about how to do one better than the other. Like I feel like it does take a lot of we got to really build that capacity and the skills for people to feel comfortable using eMental health with diverse, individuals, families. Like, how do you do digital eMental health and onboard youth if they want to do work with their families? Like, should their families also complete the same measures? Like, I feel like there's lots of great opportunities for learning, and so I'm excited by the possibilities, but I just don't want to be rigid about how we think about eMental health. That it's evolving, and you got to be open to the different perspectives people have about this. So I hope I answered that question about COVID. Things have evolved, and they're evolving in a good way, I think.
No, I think that's a great point. And I think from one of the first, thank you both from that for that answer. I think that totally answers the question. And from one of the first webinars, or maybe the first webinar we had, one of the things that had come up was that, there were a number of shifts to digital maybe quickly during COVID because folks just needed to address the needs of their clients, and the needs of their clients were that they were at home in that moment, and so they kind of wanted to be online because they needed to be online. But once folks could go back into the in-person space, folks were saying, I had to really shift my clinical services because that wasn't what the needs of my clients were anymore. They weren't online in the same way. So I think that those are a great point about not being, rigid in that, and also being able to maybe be flexible and shift. And, Jason and I, we were talking a little bit about systems changes a little bit before we started this. And I think that's a great point about how the system needs to also be flexible and adaptable to those different modalities of data collection and working with different clients. And youth in this case, who are, really need a lot of flexibility. I also had one other question, which was just about training, and you talked a little bit about you talked about in a number of cases how there's more training needed, and I was wondering if service providers talked about the types of training that might be useful. You talked about digital literacy, and just wondering if they talked about like types of training or types of things that would be useful to help service providers feel more comfortable in implementation of eMental health platforms.
I'm gonna let Jason take this one. And I have a lot of great things to say.
Yeah, I mean, I kind of, to this earlier point of one of the biggest challenges of implementing an eMental health or digital mental health platform has been that measurement-based care itself is kind of widely undersubscribed and underused. And even within AHS, I mean, we're looking at the largest health organization in the country currently. It's about to be broken into 4, but as it stands, it is. And I surveyed as far and wide as I could to figure out, hey, who in this organization does supports for frontline providers to help them build capacity with using certain measures. And there's an absolute hole in the organization. Space by space or site by site, you do see some variability. Some sites will have a clinical educator, but by and large, there's no central institutional support. So I think from that training perspective, it actually very quickly zooms out to a macro level problem where you got to say, okay, how do we actually as an organization build measurement into practice? And I think that it's not the easy answer, but the obvious answer is you need to support people in becoming competent and comfortable with measurement. And I think that's from a training perspective, there's only so much we can do. I think it needs to move towards a broader organizational lens of saying, okay, and we've seen that. We see that at London Health Sciences. We know, for instance, has measurement as one of their 4 strategic priorities. We've heard from people at CAMH similarly. So there is nationally some of that work is happening, but it's really variable. So yeah, I guess that would be my answer.
No, thanks so much, Jason. And Gina, did you have anything you wanted to add before?
I think I just to add that I think what we heard is that people might find it helpful to have like case-based, like maybe like an example of how to onboard people, how to use measurement-based care, how to communicate back the results from measures. Like sometimes people don't know how to interpret them. So just like having somebody walk them through that, and which is as Jason said, they're all already doing some of this, but that's just one thing that stands out from what I heard in the focus groups and what I'm hearing now in the interviews is sometimes those like kind of real illustrations of a potential client that you can then think about and issues that might come up that you don't know how to address it. It would be helpful to have some discussions and a community of practice, which again, Jason and the team have put together to help people come together to problem solve.
Thank you so much, Gina and Jason. Thanks again. If anyone has any other questions or anything they want to share, you can always email me. And our next webinar is going to be on June 14th and will be with Ann John and is on big data. And so we will be back then. Thank you so much for joining, and thank you once again to our wonderful presenters. I will talk to you on email. Bye.
Thanks,
Have a
everyone.
lovely long weekend.
Take care.